is the most accurate interpretation of these results as they relate to the development of delirium during the first 5 post-op days in elderly undergoing major elective non-cardiac surgery. A randomized control trial effective of post-op infusion drug XY in the incident delirium undergoing major elective non-cardiac surgery. Those are 560 people age above 65 undergoing major elective non-cardiac surgery without a planned ICU stay are randomly assigned to either drug X or drug Y. Drug Y was the comparison group in the trial. The primary outcome in incidence was going to be during the first 5. The X script is shown over here. Incident delirium is going to be 14 out of 280 and 28 over here. P-value is significant. Which of the following is the most accurate interpretation of these results? They relate to the development of delirium during the first 5 days post-op. Patients, okay. About 20 patients needed to be treated with drug X to see additional care in drug Y. So we have to a number need to treat. We need to calculate that by we need to do that. So that's going to be 10 minus 5, which is 5, and 1 divided by 5. Sorry, that's going to be it's going to be 0.05. So 1 divided by 0.05 is going to be 20. It could be okay. The absolute difference in incidence in delirium with drug X compared to drug Y is 50%. Absolute difference. So absolute risk reduction is 50%. That is also correct. The ratio of incidence of delirium and drug X versus drug Y is 2. No. X is 2. No, it's less. The relative decrease in incidence of delirium with drug X compared to drug Y is 5%. No, it's 50%. Okay, absent difference in incidence, that could be about 20% need to be taken drug X to prevent additional case of delirium with compared to drug Y. That's also a very soluble answer that can be there. We have to think about this properly. It can be either or. So drug Y was the placebo, you can say. Drug X was our main drug we're thinking over here. Number need to treat. Gonna go with B. Could be AEZ. Could be AEZ. I knew it. Had a feeling. Okay. Why not B? Because we're thinking about B. Okay, yeah. So the absolute risk is 0.5. Yeah. So absolute risk reduction is 0.05. Okay. But if we were to the absolute risk reduction, but relative risk reduction would have been 50%. Okay, so I messed that up. Okay, so absolute risk just a minus, so that'll be the control minus the treatment. That would be 0.05. And number needed to treat would be above that. And then if you were to do relative risk, relative means like your 0.05 or 0.1, which is going to be 50%, minus that by 1, so that's going to be 50%. And the relative risk reduction, so your relative risk reduction would have been it would have been 50%. That's really important. I need to kind of control think about that. It's just this minus this, so pendant actual difference, and then relative risk reduction is going to be this. So this is going to be relative reduction in treatment. Okay, percentage. So absolute risk is just between it's going to be difference between event rate, and this is going to be the percentage indicating the relative reduction. So relative reduction. So this is just going to be looking at difference in event rate and the reduction. So yeah, that's quite possible.